Hello and welcome to Medical Dialogues. I'm Anshika Mishra, and today we will talk about a remarkable case involving a girl who battled Wilson's disease, a rare genetic disorder leading to excessive copper accumulation in the body. Under the care of expert doctors at Sir Ganga Ram Hospital, Radha managed her condition for years. However, a severe hepatitis A infection led to acute on chronic liver failure. Her condition worsened with jaundice, high bilirubin level, and hepatic encephalopathy, requiring life support. The PICU team suggested a liver transplant, and Radha's mother bravely decided to donate a portion of her liver. Under the guidance of Dr. Ushast Dhir and his team, 12-hour transplant procedure was performed successfully. To talk about this case in detail, we have with us today Dr. Ushast Dhir, Chairman of Liver Transplant and Hepatobiliary at Sir Ganga Ram Hospital. Welcome to Medical Dialogues, Doctor.
Thank you.
Doctor, could you please tell us about the case history?
So, we're talking about a teenager girl who just stepped into her teens, and unfortunately, she had been diagnosed with a disease called Wilson's disease. Wilson's disease, as per the data, affects one child in around 30,000 to 100,000 children. Okay, so as you can understand, it's a rare disease of metabolism, where one of the gene becomes aberrant and it affects our copper metabolism. So it's commonly seen in males, but this was a female patient which we had, and she was being maintained by one of our colleagues, fellow gastroenterologist, Dr. Bansal, in a very well-maintained way on medication. Unfortunately, this tender girl who stepped into teenage happened to have hepatitis A virus infection. This led to an acute event on the background of a weak liver, which is what we call as liver cirrhosis. So she had already developed liver cirrhosis because of Wilson's disease. And on top of it, she had a second brunt, which is what is hepatitis A virus. Hepatitis A virus caused acute inflammation in the background of a weak liver, and the child actually succumbed to this in terms that the liver function test went for a toss. Her bilirubin rose to approximately 44, which we commonly call as jaundice. The normal value is 1. She also became a bit out of sensorium, which we call as hepatic encephalopathy. She developed water in her tummy, which is called ascites. And this all happened at a very rapid pace in this girl.
Okay, and doctor, what were the complications, the technical challenges you faced during the surgery?
So before that, I would actually like to say, when we saw this child and she had already what we call as become acute on chronic liver failure, the biggest challenge is the timing, because when the patient gets sick, they don't really give us much time. We have to move at the right pace and an opportunistic moment where we can, safely do the final treatment for this child. And we started working up this child because we knew she needs a liver transplant as a life-saving surgery. But when we started working her up, her heart pressures were elevated, which we call as PA pressures. So we involved a pediatric cardiologist, and we started treating her to sort of normalize those pressures. In the meantime, what happened is that she had a massive bout of upper GI bleed, or what is commonly called as bloody vomitus. It's a complication in cirrhotics because of increased portal pressure. These veins which develop along our food pipe can rupture, and they can cause massive bleeding. I think you can imagine a tender girl just stepped in her teens, had a massive bloody vomitus, approximately 2 liters, what situation she would be in. Thankfully, she was under our care in Ganga Ram Hospital, and with the help of our medical gastroenterology colleagues, we took her up in the evening itself, as soon she had this, for an urgent endoscopy and ligation, which was again a life-saving procedure. But because she lost so much of blood, she went into grade 4 hepatic encephalopathy, or what is commonly called as liver coma. Because of grade 4 hepatic encephalopathy, she had to be put on ventilator in an ICU, and then her kidney function dwindled, her urine output dropped, and we had to start her on what is called as a CRRT, a mild form of dialysis, so as to cope up with the acids that she was developing. So this altogether made this complex case even more complex. Now is a patient who has, suddenly deteriorated in her liver cirrhosis. She's on ventilator. She's in grade 4 coma. She's also requiring renal support. And the challenge is that the only way we can save her life is liver transplantation. Now is your question that what challenge, I've already told you the biggest challenge was to actually get a perfect window to take her up for such a high risk surgery, which is a liver transplantation, which is 12 hours surgery, involves a potential living donor. You have to justify not only the risk on the side of the patient, but also the risk on the, no matter how small the risk may be, but still you need to justify the risk on the side of the donor as well. So a patient on the ventilator on very high end antibiotics, antifungal, requiring CRRT support, we started looking for an opportunity which would be perfect for us to take her up for liver transplant. And that I feel was the biggest challenge in her transplantation.
All right, doctor, what is the prognosis now? Is the patient well now?
So, the transplant went very well, and it was uneventful. The child did not require much blood. We had a very, very smooth post-operative course for this child, and she was discharged approximately 17 days after the transplant. She opened her eyes after the transplant. That was a very joyful moment for our entire transplant surgery team, the pediatric ICU team, and our hepatologists, because we were all waiting for her to open her eyes because she had been in coma for more than 10 days before we took her for transplant. That's the key thing. So the first joy we had was when she opened her eyes after transplant. The second joy we had when she started normalizing her liver function. And when we discharged her, her liver function tests were normal. Her bilirubin, her jaundice is totally gone. She's back home doing well with her siblings and ready probably to go to her school after this summer vacation. As far as prognosis is concerned, we define it in short-term and long-term prognosis. Short-term already she has shown quite well recovery, and I'm very hopeful she will do well. She's a fighter. A patient who comes out of ventilator who is so strong, mentally strong, has to do good. But as far as transplant is concerned, she has an excellent prognosis from now onwards. We generally say it's 90% success in terms of allograft survival in such patients for over 5 years. I think she should do extremely well in future because of this transplant.
Thank you, doctor.
Thank you very much.
The case was managed extremely well with tremendous efficiency and expertise of Dr. Ushast Dhir and his team. And salute for giving new leash of life to patients who had lost all hope and undertaking such a high-risk surgery.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.